Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Réka Gustafson, who's the Deputy Provincial Health Officer and leads the BC Centre for Disease Control. And this is our COVID-19 briefing for British Columbia for Friday, February the 19th. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. There will be a written briefing on Monday at 3 o'clock, and then on Tuesday from Victoria, Dr. Bonnie Henry and myself will be providing an in-person briefing on Tuesday afternoon. We are looking for members of the media to move up slightly earlier in the day, these briefings, and we'll have more information about that early next week. And with that, it's my honor to introduce Dr. Réka Gustafson.
Good afternoon, everybody. It is my pleasure to bring you the briefing for February the 19th, 2021. Today, we are reporting of 508 new diagnoses of COVID-19 in British Columbia, which brings the total to 75,835. 116 of these were in Vancouver Coastal Health, 286 in Fraser Health, 22 in Vancouver Island, 59 in Interior Health, 25 in Northern Health, and there were no cases in the past 24 hours or since the last reporting from outside of Canada. At this time, there are 4,486 British Columbians with active case of COVID-19. 217 are in hospital at the moment, and 61 individuals are in critical care or intensive care. 7,699 individuals are currently under active public health monitoring for exposure to COVID-19, and 69,970 people in British Columbia have fully recovered from COVID-19. In the last since the last reporting period, we have 6 new deaths to report, and of course extend our condolences to the family and loved ones of those who lost their lives. There's one new healthcare outbreak reported in the Interior Health and at the Florentine Long-Term Care Facility. There are 13 active outbreaks in long-term care facilities at this time, and 6 in acute care. There are 734 individuals with COVID-19 at the moment in these settings, 447 residents and 287 staff. The outbreak in Cannon Lake is now over. We are also monitoring variants of concern which are being monitored around the world. And as of yesterday, there were 72 identified in British Columbia. 52 are the B117 type, and 20 are the B1351 type. Since the start of the COVID-19 immunization program, 192,942 doses of COVID-19 vaccine have been administered in British Columbia. 36,923 of those were second doses. Yesterday was the highest number of doses were administered in any single day. 12,250 people received a COVID-19 vaccine in British Columbia yesterday. This is very good news, because with every individual that is protected through vaccination, we are all safer. The preliminary evidence from our immunization of our elders and seniors living in long-term care facilities is actually very encouraging. We are seeing a decline in outbreaks, and we are seeing a local assessment of effectiveness has shown us that there's substantial protection in the frail elderly from vaccination. This is a very important finding, because this is the population at highest risks of severe illness, and it's not a population that always responds particularly well to vaccines. So this is actually an extremely good finding for us. We have not yet eliminated outbreaks completely, but we have seen strong results of vaccine effectiveness. A little bit about where we are today. This has been a long and difficult journey for many of us, but with highly effective vaccines being administered throughout BC, we have every reason to feel encouraged. Taking the preventive measures to prevent COVID-19 are like other healthy behaviors. It can be more challenging some days than others, and we do better than some days than others. At this stage of the pandemic, it is key to be supportive of each other and focus on the things that make a real difference. Staying at home when you are sick, avoiding gatherings, following the safety plans of your workplace and school, and getting tested if you have symptoms of COVID-19. And if you do test positive for COVID-19, please continue to work with your local public health who are there to protect you. Contact tracing and outbreak management remain key components of COVID-19 response because this virus tends to spread through clusters and known chains of transmission. So when a notification of an exposure in your school or workplace occurs, you have a role to play. It means the system is working for you and working for all of us to protect us. There are many things now that the days are getting longer that we can enjoy safely, and that's a really important thing to think about in terms of our mental health. We can pick up a coffee from our favorite coffee shop. We can get outside for a hike or a snowshoe. We can see a friend for a walk and get a boost from the boost we need from that safe social connection. And connecting and looking after one another is important to our overall health. So please remember to reach out to those who may be alone. A phone call may mean the world to them. And COVID-19 has shown us that we have more in common than what separates us. And I really would like to thank all British Columbians at this time in the pandemic for having persevered and having continued to take the measures that we need to keep us all safe. Thank you. And I'm happy to take any questions.
Thank you very much, Dr. Gustafson. And just to start, on behalf of the Premier and I think everyone in BC, I want to pass on my condolences to the family, friends, and caregivers of the 6 people who passed away from COVID-19 in the last day. 4 of them lived in the Interior Health Authority and 2 in Fraser Health. This is a very difficult time to suffer loss, and we think of them and we feel for them today. Wanted to note, Dr. Gustafson talked about the results, and I'll be talking about this in a second, of our immunization efforts in long-term care and in assisted living, and the reduction both in the number of outbreaks and the scope of recent outbreaks, which have tended to be where they've happened a relatively small number of people, not the kinds of outbreaks we saw in November, December, and the first part of January. But I would, with respect to acute care, we continue to have adequate capacity in acute care. Our overall utilization rate in acute care is 90.8%. That means there are 859 base beds available or vacant, 72.5% of all beds, including surge beds. That leaves us 3,280 beds. And in critical care, the occupancy rate is 77.4%, which leaves 120 vacant beds, and 54.6% of base beds and surge beds. That leaves us 345 beds available. Just a few minutes ago, posted on the BC CDC website was the immunization data by long-term care home and by assisted living home throughout British Columbia. Across the province, you'll see the excellent results everywhere in BC. You'll see that by care home. You'll see that the average for residents in care homes is 91% rate of immunization. There's some variation in some care homes that have significant outbreaks where people, in fact, have been diagnosed with COVID-19, but nonetheless, everywhere in BC, the rate of immunization is excellent. It's at 92% in the Fraser Health Authority. The lowest is 85% in Northern Health. And as you can see from the report Dr. Gustafson did, we have been carrying on with second doses, I think doubling the number of second doses in the last 7 days that have been provided in BC. Many of those are for staff and residents in long-term care. And that opportunity and that provision of a second dose in facilities also allows us to clean up some people who may have missed first doses for a number of reasons in long-term care the first time through. Obviously, there's people coming into long-term care as well in these times, and so we have to maintain this effort over time. We'll continue to update this data in terms of residents in the coming weeks, including adding the data about second doses to residents in long-term care and assisted living homes across BC. And next week we'll be providing data as well with respect to staff. I just want to say with respect to the immunization campaign, yesterday was our largest day, 12,251 people immunized. More than half of those were second doses yesterday, reflecting the need to do that work. So 5,280 were first doses, 6,971 were second doses. I would say this about it: 192,942 doses delivered. The Pfizer vaccine came in the middle of the week, and yesterday we had our largest day of immunization so far, and we'll be having a similar one today. The immunization campaign in British Columbia, the effort in British Columbia, has been, I think, delivered at a very high level by our public health teams, and I wanted to publicly thank them for that. We set out what our priorities were, and you can see the long-term care and the assisted living priorities have been very significantly met, and we are currently meeting our priorities with respect to second doses. With other vulnerable communities, that's true as well, including rural and remote Indigenous communities. In short, the delivery to date by our public health teams of the immunization campaign, and the credit for that is really for all of the people involved, the health science professionals and the nurses and the doctors and the healthcare workers involved who've done an outstanding job, and the communities that have worked with them. I think they've done exceptionally well. Obviously, we would like to have more vaccine. The only issue holding back the immunization campaign ever at this stage is supply. But I wanted to just acknowledge that so far the campaign has been delivered on the ground in a way that should inspire confidence in everybody, and I'm very proud of all of the teams involved. Many people who are over 80 who will be expecting to receive their immunizations in the month of March are obviously interested in that, and we'll be providing more information about that shortly. But in general, if you are in the general population, in other words, you're not connected through home support or living in independent living or others, you can expect to be vaccinated between March 15th and the end of March. And if you're connected to the healthcare system, for example, you receive home support, you'll expect to be vaccinated in general between March 1st and March 15th. More information about the details, the websites, the numbers to call in will be provided in a detailed plan coming forward. But people can have confidence that just as we've delivered so far, we're going to be making every effort to do that well and effectively. The Prime Minister today talked about the amount of vaccine coming to British Columbia, and we are receiving this week, based on 5 doses per vial, we've received about 45,000 doses. If you count it as the federal government is 55,000 with a 6-dose vial, that's come in this week. We're expecting similar amounts in the next 2 weeks. But that represents a relatively small percentage of British Columbians. And I just want to remind everyone, and it's a reminder that we have to continue with public health measures, remind everyone that that by the end of March it will be around 10% if the federal government is able to acquire the vaccine that they have promised to acquire. And that means all of us have to continue to follow public health orders. I just want to say finally, and many have commented on this in the last couple of days because the BC CDC, thanks to the efforts of Dr. Gustafson and her team, provides information on local health areas and rates of COVID-19 and new cases of COVID-19. I just note that what the last number of days have shown us, in Fraser Health, which has the largest number of people diagnosed with COVID-19 and has consistently, and of course is our largest health authority, the communities that have the highest rates right now, the highest number of new cases in the last week, are Abbotsford and the Tri-Cities, and that's a bit of a change. Tri-Cities, of course, has a higher rate of infection right now in the last week, not over the course of the pandemic, of course, but in the last week. And then, for example, Surrey, which has traditionally had a higher level. What it tells us is that COVID-19 is everywhere, whether you're in Prince Rupert or the Tri-Cities. It makes no sense now to go in person to do karaoke. It makes no sense now, when you can do it virtually, to go and have a trivia event with other people. COVID-19 is everywhere in BC. There are challenges with the variants, and we have to, right now, follow public health orders that I think are actually well understood but need to be followed. We know, because it's about health, that some days we don't do as well as others. We don't eat as well. We don't exercise as much. But that was yesterday. Today and tomorrow, we have to really focus now, in this time when we have hope on the horizon, but it's still on the horizon, to follow the orders of Dr. Henry, to follow the advice and counsel of Dr. Henry and Dr. Gustafson. In short, what we've done is a start, but it's just a start. There are 4.3 million people to be immunized, and 156,000 having received their first dose. A further 37,000 having received their first and second doses is a start along the way, but it's 4%. It's 1 out of every 25 people. So the percentage that must matter to us now is 100%. We have to stay 100% all in, committed to stopping the spread. Showing that kindness to each other, using the skills we've been taught to stop the spread, is key to our pandemic effort. And it tells those delivering our vaccines that even if it's not our turn yet, we are right there with them, helping to give their work every chance for the greatest success. Have a safe weekend, everyone, and we'll see you on Tuesday with a report on Monday. Aujourd'hui, nous annonçons 508 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 75 835 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 6 nouveaux décès liés au COVID-19 pour un total de 1327 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 217 personnes sont actuellement hospitalisées, dont 61 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister Dix. As a reminder to everybody on the phone line, please press *1 to enter the queue. You'll be limited to 1 question and 1 follow-up only. I would also ask that you please take your phones off mute. You're not audible until your name is called. First question this afternoon is from Richard Zussman, Global News.
I'd like to ask about, first, the situation at Little Mountain. The executive director there has now resigned. Minister Dix, is this an admission of wrongdoing? And what do you say to families who say changing one person isn't enough to fix what has happened to be the largest outbreak in long-term care in the province?
Well, I think in that case, Little Mountain is a contracted provider of long-term care to the province, and officials and people from Vancouver Coastal Health have provided enormous support to that care home in this very, very difficult period. I don't think, and in this case, they've provided assistance and support as we can continue to work with residents and with families to ensure continuity of care. So someone has decided to step down after what I think we'd all acknowledge has been an extraordinary period. But I don't think it's, I wouldn't draw the conclusion you draw. I would say that Vancouver Coastal Health, working with the care home, working with this contracted provider, is doing everything it can now to provide supports, including support in terms of interim support in terms of management. So this is as it should be, that ongoing support is being provided. Obviously, the situation at Little Mountain, but not just Little Mountain, other care homes across British Columbia, and there are a number still dealing with significant outbreaks. I think of Acropolis Manor in Prince Rupert. I think of George Derby and Burnaby, amongst others. That this is a very, very difficult time, because even though, as I noted, there has been an extraordinary effort to immunize in long-term care and assisted living, those outbreaks to a large extent precede those immunization efforts and continue to have effect on people, as does COVID-19. But in the case of Little Mountain, a person has stepped down. People are quite right to say changing one person is not everything. Of course it isn't. But the supports are being provided by Vancouver Coastal Health to our contracted provider, and they work very closely together. And there's a long way to go in this pandemic, a lot of work left to be done, and a lot of work left to improve long-term care in BC.
Richard, do you have a follow-up?
I do. There's a picture that was floating around social media of two well-known former Olympians who live in Quebec, who traveled to Rossland, in theory, to ski. The photo was captured at a local bar, no masks on, close together, and clearly they do not live in the same household. What do you think what message do photos like this send? Are they concerning to you? And does this speak to the sort of fatigue that everyone is feeling here around ongoing restrictions? And do you worry that seeing something like this could lead people to say, well, I'm just going to go break the rules too?
Oh, I don't think the latter is the case. I think the overwhelming majority of British Columbians are following the rules and are tired of those rules at the same time. The fact that they're tired of those rules doesn't change the fact that they're following them. And, I'm sure many people in British Columbia, when they see that, and they see other incidents such as that, and we've seen those over the course of the pandemic, people not following guidance or not following rules, a small handful of people. It makes all the people following the rules really frustrated. But I don't see any indication that seeing hygiene behavior, which is not consistent with public health orders, which are guided on keeping people healthy and are designed to keep people healthy, I don't see evidence that people look at a picture like that and they say, oh, well, I should not follow the rules. I should not keep my loved ones healthy. And with respect to people who make mistakes, well, today is a new day, and it's important now that people follow the rules. It's important today that they follow the rules, because we are in the midst of this. More than 500 cases today. It's a significant number of cases. We've got more than 200 people in hospital, less than before, but a significant number of people in hospital. And now is the time to follow the rules.
Next question is from Justine Hunter, Globe and Mail.
Thank you. Dr. Gustafson, we've got the research now from the BC CDC and new data out of Quebec. There's the report in the Lancet yesterday out of Israel. I'm just wondering, is there consensus building that we should be focusing on delivering the first shot to as many people as possible and defer the second shot for up to 90 days as they're doing in Quebec and in the UK?
Thank you for that question. There is certainly vigorous and rigorous public health debate on that, and one of the contributors to that debate has been actually a recent letter in the New England Journal of Medicine by a scientist from the BC Centre for Disease Control, and the data are in fact accumulating that a first dose of the messenger RNA vaccine gives substantial protection in the short term. In fact, it gives very similar protection to what we see in the trials from 2 doses. And that's a really important debate and discussion to have, and we continue to have that debate and discussion in Canada and around the world. What we're all trying to do, is maximize the protection from the available vaccine to the entire population. So I would say that the data are being looked at very, very carefully, and evidence is accumulating to support that as a potential approach for maximizing protection in the population.
Justine, do you have a follow-up?
I do, and I didn't hear quite the answer, but I still have another thing to ask. So if Minister Dix wants to weigh in on that one. But my question now is those churches who are fighting the health orders out in Chilliwack say they will open their door to services on Sunday. And I'm wondering what kind of enforcement should be expected by people who choose to go to church on Sunday in defiance of the provincial health orders.
Well, I think first of all, I would say on the second dose that we continue to provide second doses. So you see now that number's doubled. I think we were about 18,000 as of last Friday. Now it's almost 37,000, and that's obviously something we continue to do particularly in the places where we delivered first doses early, which are long-term care and assisted living and acute care. So that process continues. With respect to the court case that's been brought forward against the provinces by a select number of churches, that matter is still before the courts. Obviously, the orders apply, and they apply across BC. And overwhelmingly, I've been moved because from the beginning of the pandemic, from March of 2020, I and the Premier and Dr. Henry have been meeting with faith leaders across the province, and I've been moved by the extent to which faith leaders, community leaders of all faiths, have followed the orders, even though it obviously has a huge impact on churches and on synagogues, on temples, on gurdwaras, on mosques in BC. And yet, people have followed those rules and continue to. And I think, one of the real tenets of faith is to keep one another and support one another in our health, our spiritual health, but also our physical health. And those are the lessons. Those lessons are everywhere in religious texts. And I think the behavior of people across BC in protecting their congregations demonstrates that. So I expect people will continue to follow provincial health orders across BC. And of course, there will be a need to enforce in some cases, but I'm not going to comment on that part, which is the responsibility of the agencies that enforce things, except to say that I am gratified by just how many religious leaders have not been just been following the rules, but contributing and finding other ways for people to follow their faith and follow their path.
Penny Daslow, CTV.
Can you hear me?
Penny, are you there? Yeah,
Yes,
go ahead.
can you hear me now? Sorry about that. This is a question for Dr. Gustafson. We keep hearing that vaccinations are in a race against the virus, and now when we start hearing about variants, it seems that race is much more intense. So I understand that, vaccine quantities are out of your control, but testing is under your control, especially when it comes to finding and containing variants. We keep hearing it's critical, yet BC is testing well below the national average. So I'm just wondering, why aren't we testing more, and will you be expanding testing?
So that's a great question. Actually, testing is available for any British Columbian who wishes it. So there is actually good testing availability, and people who present for testing get a COVID-19 test. So I think that's the really most important thing. We try to give the best possible advice to people on when to get tested, and as I mentioned before, it's available to anyone who wishes it. Sorry, was there a second part to that question?
Well, it's just that we're not doing a lot of tests today. I mean, we're averaging about 7,000 a day. We've got capacity up to 20,000. And in December, the restrictions, you're told, and the requirements on the CDC's website, there are only key symptoms that are supposed to be tested now. So I think whether that's keeping people away or they're being turned away, our testing just is way below the national average. Like, we're simply not doing it. So is there a plan underway to try to test more people for more symptoms? Are you considering, asymptomatic spot testing just for when people are pre-symptomatic? I guess I'm just wondering why we're not doing more to try to filter and test to see what's out there.
So testing without symptoms is actually not a strategy that has been proven to be particularly helpful. And again, our testing guidelines in British Columbia have actually quite a low threshold. And there's two things that are important. Our testing guidance to the public is focusing on when you should really act. You should really not delay and get a test right now. But absolutely no one who presents for testing should be or is being turned away for testing. At the end of the day, we test people who present for testing. And one of the reasons maybe that our testing is relatively, or is what it is that the measures that we're taking that reduce the rate of COVID-19 actually reduce other respiratory illnesses as well. And because we generally test people with symptoms of respiratory illness, if we have less respiratory illness in the community, fewer people will be presenting for testing. But I would say that looking at our strategies and our approach to testing, we actually have no indication that we're missing large numbers of cases or even substantial number of cases. And the idea of proactively going out and testing asymptomatically is something that we thought about early in the pandemic, but has not been used, that has not been found to be a useful exercise.
Penny, do you have a follow-up?
I do, and thank you for letting me have that. Today, the federal government presented some concerning modeling about a third wave. They're warning that we could see up to 7 times the number of daily infections we're seeing now by the spring if these variants do take hold. They're emphasizing stricter public health measures are probably needed. Ontario is already extending lockdowns. And I'm just wondering what the plan is for BC. When you're planning to make changes, what kind of changes those could possibly be, if there's a threshold you're looking at?
So for your first question, mathematical models are exactly that. They're mathematical models, and they take the parameters that we are seeing with these new variants and then give us potential scenarios. They don't predict what's going to happen. And I think that's really important to remember. So what we need to do, and what we have been doing in British Columbia all along, is respond to our own pandemic. The mathematical models give us reasonable or useful scenarios to consider for the future. In terms of a third wave, again, COVID-19 is not like influenza, that it tends to sort of travel in waves or occur in waves. It actually tends to, what we're seeing is it tends to spread through known chains of transmission. And in terms of a third wave, I think what you're saying does the possibility of a resurgence of cases exist? And yes, it does. A possibility of resurgence of cases absolutely exists, which is why we're doing what we're doing, which is maintaining public health measures, monitoring the spread of COVID-19 in our population very, very carefully, and then really adjusting our public health measures when it is possible to do so, and focusing on the settings and situations where COVID-19 has a tendency to spread, which is really through uncontrolled gatherings and interactions. So gatherings and interactions in situations where you can't have a safety plan. So there is actually no indication from the behavior of the variants that we need to do anything that is different. And what we mean by that is that the mode of transmission of the new variants is very similar to other variants. The virus is just more efficient at transmission. What that means is that the things that we need to do to prevent the transmission of variants is the exact same thing we do to prevent COVID-19, but we have less room for error. And as we talked about before, this is the time where many of us have been doing this for a really, really long time, and none of it is new, but we have to recommit to doing them consistently and staying home when we're sick, not having gatherings. And that really important message is not to worry about what picture you've seen in the newspaper or what somebody else is doing, but you yourself committing to those things that we know prevent COVID-19. And I think that is actually a really important principle of controlling COVID-19 and controlling any variant of COVID-19. The measures we're taking right now, we're finding controls variants of COVID-19.
Next question is from Jane Side, North Shore News.
Hi. We've recently seen some high numbers of increasing cases on the North Shore in North and West Vancouver. There have been a lot of notices that have gone out to schools warning of exposures. So families with children are obviously being exposed. I'm just curious to know what kinds of activities, I guess, are behind the increasing numbers on the North Shore, because gatherings is a very general term. Are we talking about kids' birthday parties or adult get-togethers? And I'm curious about sort of, I guess, what ages are involved and what general kinds of activities are involved in the spread that we're seeing.
So actually, I don't have that information specifically about the North Shore or those specific cases. But if I may, I would like to actually address a little bit your first part of your question, which is the exposure notifications in schools. We can certainly provide more information about the clusters in North Shore. I don't know if the minister has any. Do you have detailed information on that?
But I can say so.
Okay. But what I would like to say is when there are higher cases in the community, that's when you're going to get higher rates of notification in schools. What I would really like to emphasize about those is that over 90% of those notifications do not lead to a secondary case. So if you receive a notification in the school, what that means is that the system is working. Cases are being identified and you're being notified of those cases. And they are, by and large, the numbers of those notifications are a reflection of activity that you quite rightly note is occurring on the North Shore. And is there
Yeah, I think that's good.
Okay, and if we have any further detail about the North Shore, we can certainly get back to you on that and give you more information.
Follow-up, Jane?
Yeah, I guess so. I'd still like to get more information about the North Shore in terms of what activities are driving that, because people are curious and we don't have any information. I guess my follow-up question is about the variants. The numbers of these are rising. I guess I'm curious to know, how are these variants originally getting in when we have all of the quarantine procedures and all of the testing procedures that people are supposed to go through before they get on a plane, and then they're supposed to quarantine by themselves when they arrive? How is it possible that these variants have managed to get in when we have all these safeguarding processes in place?
So a little bit about variants. Variants are, of course, natural occurrences. This is what viruses do. They genetically change. And what we're able to do in British Columbia, because we have actually very high rates of testing and whole genome sequencing, as well as screening for variants, is to monitor their as these viruses evolve. One of the things we have seen through a survey, a point prevalence survey, is that we have actually compared to transmission from elsewhere, we actually have very small numbers of these new variants at this time. And that is because, as with other cases of COVID-19, because of the travel restrictions we have in place, we actually have a very small proportion of overall cases related to travel. So I would say that at this point, the restrictions that we have in place are highly effective, but they are not 100%. And again, that's why we need to practice them consistently. That's why we are trying to apply them in as many situations as possible, and we're minimizing the spread as much as possible. But it's not going to be 100% in a pandemic. And one of our goals is to make sure that we minimize such transmission. And we're also able, as I mentioned before, through testing, monitor the spread and respond as needed. So your question is how is that possible? Some travel does occur. The measures we have placed are highly effective, and nothing is 100%. But our results are actually that to date, we've had very little spread of these variants. And we're going to continue to monitor that, because one of the things that we know about viruses is that a more transmissible virus can outcompete a less transmissible virus. And so that's one of the reasons that we're monitoring it and keeping an eye on it. Would you like to add anything to that?
And I think we've seen in some of the modeling, Jane, where we see transmission these days. It does happen in gatherings frequently, where people are living, either many people in a house or in congregate circumstances. So that continues to be a significant source of transmission. Over the course of the pandemic, we've seen workplaces, and remember, this isn't unique to the North Shore, because people on the North Shore would work and have activities in different places, but the industries where there have been challenges over time include manufacturing, include food processing, include agriculture, and of course include in particular, because it's has fewer people on those sites, some fitness facilities, and that's why rigorous COVID safety plans need to be put in place. They're the responsibility of employers and employees, but in particular employers, to ensure those take place. But we continue to see transmission in the community, and that means when people are engaging and interacting with one another in large numbers. And we've seen a couple of cases. Dr. Henry referred to one on Tuesday, where people came together at a particular establishment and engaged in a trivia night, and the consequences of that are significant. And what we'll try and do in the next number of days is give some more examples of those for people, perhaps by infographics, so you can see the way in the present period COVID-19 has been spreading in BC. I don't think it's spreading differently on the North Shore than it is in other places, or in Vancouver Coastal Health against Fraser Health. I think those the ways it transmits are similar, and so what it says to us is that the ways to deal with the variant and the ways to deal with transmission are using our COVID sense, following provincial health guidance, and following provincial health rules. And we have to continue to do that, and we really have to commit to it now in this period where we're still in respiratory illness season, Well, we have hope in the horizon with vaccines. These next number of weeks, these weeks from now through to April, are going to be critical to managing the pandemic, both with variants and with COVID-19 in general.
Marcella Bernardo, News 1130.
Hi, everyone, and thank you so much for taking my questions today. I have to go back to Little Mountain Place, if I could, Minister Dix, and just ask you about, with the third wave possibly coming, I've spoken to a lot of family members who are very concerned about a lack of communication, not just from Little Mountain Place, but from other care home operators, where you're being told you can't visit your loved ones, but when you call and try to get information, you're not given it. And I've spoken to several family members now who are saying that communication is horrible with care home operators when they ask for an update. What assurances can you offer us that if this virus keeps getting into care homes, that people will be able to call up and get the information they need about their loved ones?
What I can say, Marcella, is that I think, and this has been a long time coming, both for me personally, and my family personally, but for anyone involved in long-term care, that the immunization statistics, which we presented in detail today, 91% of residents, I believe it's somewhere in the neighborhood of 35,000 to 36,000 staff people in long-term care, 5,000 to 6,000 essential visitors being immunized. The fact that we've gone from, I think the number was 59 on December 15th, 49 on January 15th, to I think 14 outbreaks in assisted living and long-term care, tells us that immunization campaign is working. And certainly as we were proceeding with second doses, and you see that in long-term care, you see those numbers because they were the early dose people who received first doses. What we're looking at in the coming weeks, as we complete second doses, is to create more opportunity for people to visit their loved ones in long-term care. And this will create, in this circumstance, makes it better for residents of long-term care, for their families, and for the staff working in long-term care. So absolutely, communications should always be good. In the case of some care homes, these were unbelievably difficult times, as you can imagine. That I can tell you that moment when an outbreak is declared, when you have a family member in a care home, is a terrible day. And you, if you could get minute-by-minute updates, you would want those. I know that's the case. And I think everyone should do as good a job as possible. But I think what we hope is going to change soon in long-term care, what we hope is going to change soon is assisted living, is the fact of immunization and its obvious effect on the transmission of COVID-19 in long-term care is going to bring other changes, and I expect it will do so, we believe, in the month of March, where people are going to have more access, not less, and more opportunities to engage in, not less. And that's why we did long-term care at the beginning, why we completed long-term care so early in front of many other jurisdictions, because we understand that the impact of COVID-19 on long-term care is not just the cases and not just the unbelievable weight of tragedy of people who've lost their lives, but also the quality of life in long-term care. And the pandemic has negatively affected that, and we want to move back as soon as we can to the best possible circumstances we can get to.
Marcella, do you have a follow-up?
I do. I'm sticking with communication now, and I really hate to have to ask this here, but I'm not getting the answer anywhere else. So, Minister Dix, I'm not sure if you've been given this information, but I'm trying to track down exactly how many of the 676 cases at Whistler that have been recorded since January 1st are indeed people that live in the area, and how many of those are people that do not live in Whistler. And for some reason, somebody has these numbers, and they're not sharing them.
Well, I would say this, that if, for example, Marcella, you live in Community X, let's not give it a community name, right? And you were to visit Whistler, and you were to have COVID-19 transmitted to you while you were in Whistler, and you returned home, and you tested positive in, say, Fraser Health, that would count as a Fraser Health case, right? Because it's the place where you reside where we define the case. So in the case of Whistler, what we're talking about in general, and I think this is just true, when we announce, say, as I think we did in the last week, about 60 cases, I think Vancouver Coastal Health did a bulletin yesterday about 60 new cases of COVID-19, and the reduction in transmission there, that means 60 people who live in Whistler. They may not live in Whistler all the time, but they're living in Whistler now, or they're living there and working there for the season. So I think that's your answer. If I can cut through all that and really give it directly. The Whistler cases that we announced as Whistler cases are people who live in Whistler and have Whistler as their primary address.
Next question is from Keith Baldry, Global News.
For this, on Monday, Dr. Bonnie Henry was asked about the Western Hockey League potentially opening up, and she said that they had not submitted a plan to public health yet. Since then, Western Hockey League officials say they have submitted a plan of some sort, and we're just wondering if there's an update to be had on that.
Thank you. Yeah, the Western Hockey League submitted a plan in early February. It was 65 pages. It's being reviewed by public health, by officials of the PHO, of the Provincial Health Office. I expect they will have recommendations around that to Dr. Henry next week, and then we'll be responding and working with the Western Hockey League. There has been work that's gone over time, but a plan was received. I think it was sent on or around February 2nd. It's been received. We're working on the plan, and we'll be responding to the plan soon.
Follow-up, Keith?
No, that's good. Thank you very much.
Thank you. We have time for one more question this afternoon. As a reminder to everybody on the phone line, Dr. Gustafson and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic support, visit gov.bc.ca/COVID-19. Last question this afternoon is from Tina Lovegreen, CBC.
Thank you so much. Dr. Gustafson, you mentioned we don't need to do anything differently when it comes to preventing the transmission of the variants. But are you changing any of your procedures or time frames when doing contact tracing, for example, as a result of the variants? You know, for example, considering a shorter exposure period, or including those wearing a mask as a contact, or including those further than 2 meters away as a contact?
Those are really good questions, and actually goes back to that idea that at this time, there's no indication that those parameters are different in a variant. And what that means, that is there a longer incubation period? Is there a longer infectious period? In fact, there's no indication that that's the case for variants. What we know is that a higher proportion of contacts tend to actually develop COVID-19 than with the previous variants of COVID-19, which means that it's really not a question of doing something different. It just makes sure that we absolutely have to do our very best to follow those the measures, and also to really do excellent case and contact management, which means that all contacts who are asked to self-isolate actually need to self-isolate, need to adhere to those recommendations given by public health, because there's less room for error. One of the things we know is, for example, we've had recent information from one of the health authorities who was monitoring the proportion of contacts that actually go on to develop COVID-19, and it's really that number that gets about 40 to 50% higher. So we know that if you've been asked to self-isolate, that is a really, really serious and important recommendation, because the probability that you will actually develop COVID-19 is higher with the new variant than it was previously. But the mode of transmission, how long you're infectious, the fact that it's spread through respiratory droplets, those have not changed. So your question is actually really, really pertinent. It's not a question of doing something different. It's doing what we know we need to do, and doing it really consistently and really well, because there's less room for error.
Tina, do you have a follow-up?
Yes, thank you very much. Minister Dix, I'm wondering if you can please answer in French the question about why BC will continue to administer second doses of the vaccine when the new information from the BC CDC seems to indicate lives could be saved if we focused only on the first dose right now. Thank you.
Parce qu'on suit l'évidence, n'est-ce pas? Il y a de plus en plus de l'évidence sur ces questions. Ces vaccins ont été développés et distribués pour la première fois au mois de décembre. Les tests cliniques qui ont été faits ont utilisé une différence entre 21 jours et 42 jours, n'est-ce pas? Donc, en général, on suit l'évidence. Il y a de plus en plus de l'évidence, mais on n'est pas maintenant, on n'a pas décidé jusqu'à maintenant de changer notre position. Vous vous souvenez du fait que quand le Dr. Henry, en travaillant avec Dr. Gustafson, a pris la décision de 35 jours et puis de 42 jours, il y avait beaucoup de gens qui ont critiqué cette décision, mais c'était la bonne décision sur l'évidence du moment. Cette évidence évolue. Mais une dernière chose, on a donné du vaccin à nos résidents des centres de soins au long terme dans la province, dans le mois de décembre, dans le mois de janvier. Et il va falloir une deuxième dose. Et je pense qu'après tout, il faut nous assurer que des gens sont sains et saufs dans nos centres de soins un peu partout dans la province. Cette situation est essentielle pour moi. C'est essentiel pour la santé publique, c'est essentiel pour le Premier ministre, c'est essentiel pour le Dr. Henry, c'est essentiel pour le Dr. Gustafson. Donc, le fait qu'on a continué de faire des deuxièmes doses, 37 000 jusqu'à maintenant, démontre notre conviction qu'il faut agir dans ce domaine-là et que c'est important. Donc, on va continuer à suivre l'évidence. C'est possible qu'on va changer, mais pour le moment, on continue de donner des deuxièmes doses aux gens. Merci beaucoup. Thank you very much. We'll see you on Tuesday.